Hello, welcome to my channel and welcome to LaproCare World. So today I am Dr.Saurabh Dixit. I am going to show you a very good case, and this is a case of incisional hernia. So it's a ventral hernia and this is seen post surgery, and that is why this is known as incisional hernia. So with me I have my RMO, Dr. San. So he will be giving you a bedside clinical brief history about the case. So can you tell me about the case?
Hi. Good afternoon, sir. Actually, the patient is came with complaint of post pain abdomen with vomiting and pain abdomen. But this is the case of sir post cholecystectomy done somewhere else, not in Delhi.
Okay.
So after that, the
Patient is
having some bulge. So we have done the USG in which the
Okay, so students, whenever we talk about the case presentation, why I engage my RMOs in such kind of activity, because I want the clinics to be better. At MBBS level, most of you struggle with the clinics. So getting a degree is not only the solution. That is why I always encourage my people to come and do the case presentation. So let me tell you, this is a patient who underwent open cholecystectomy. Can you see? And now my question is, what is this incision better known as? So this is what incision? Cockers. So this is a cockers. Cockers is an incision that we make for the hepatobiliary surgeries also, and for the thyroid surgery at the level of neck. When we talk about neck, it is between the two sternocleidomastoids and two finger breadth above the sternal notch. So this is what is cockers, that we do it for the thyroid surgeries, and this is the cockers that we use it for the open cholecystectomy or CBD related procedures. So this patient underwent cholecystectomy, and now this patient is having a bulge. Now how do we conclude that this is an incisional hernia? So what are the findings that tell you that this is an incision related hernia? What did you find in this? Was there any bulge noted here?
yeah, yes.
Okay.
Bulge is noted, sir, when the patient is going to on cuff.
Yeah, so can you ask, आप उधर सर करिए. So always remember, incisional hernia is best depicted when the patient cuffs. So ask him to cuff.
बाबा जी आप खांसी करो थोड़ी.
खांसी. So can you see? Okay, bus. Can you see? This is a bulge. This is a definite evident bulge. Now if you see the abdominal wall, this is not allowing the fingers to insinuate. So fingers are not going inside. Gently, if you try to examine this defect, your fingers are easily insinuating. Can you see? I can feel multiple buttonhole defects here also, and there's a big defect here. So this is probably a incisional hernia. So when we talk about the incisional hernia, what category hernia it is? It's a ventral. This is basically, if you talk about the broad perspective, it's a ventral hernia post incision. Now when we talk about ventral hernia, what is a ventral hernia? Hernia on the ventral abdominal wall. It could be considered as a midline hernia if it is between the two rectus. I have already made a video on this, and if it is lateral to the rectus, it is known as a lateral wall hernia. Had this hernia happened without an incision, this is below the subcostal margin, above the 3 centimeter mark of the, you can say, umbilicus. So this is a subcostal hernia, but since this is seen post surgery, this would be considered as an incisional hernia. Now when we talk about the management of incisional hernia, we have two scopes. Either we go for open or we go for a laparoscopic repair. When we go for an open repair, we'll do nothing. We'll dissect off the hernial sac, we'll reduce the sac and its content, and then we will go for either a rectorectus or a preperitoneal mesh placement. But nowadays laparoscopic surgeries are more convenient, less time taking. So we have planned an extended IPOM for this. What is an extended IPOM or E-IPOM or IPOM plus? What is that? So IPOM is intraperitoneal onlay mesh repair, and why it is known as extended IPOM or IPOM plus? I would also do an intracorporeal suturing inside. So I would approximate the defect and then I would put a mesh inside. So this is what is very important. Students, the choice of mesh is again a big task. Why it is important? Because if you use a small mesh, the mesh will contract and this will not provide an effective, you can say, protection. So we need a mesh that should cover at least 4 to 6 4 to 6 centimeter extra over the defect. And that is why, suppose if this mesh is of defect is of 2 and 2 centimeters, we always take 2 plus 8 or 10, 2 plus 8 or 10. So if it is a 2 centimeter by 2 centimeter defect, we will take a mesh of either 10 by 10 or 12 by 12. So we are going to go for an IPOM or IPOM plus for this patient, and I will upload that video also for you. So we should be thankful to these patients because they have been helping us with the case discussions and serving them for, you can say, study of you. So we should be respectful to them, and I'm really very thankful to everyone watching this. Do share the links of this video with your near and dear ones, and do subscribe to my channel. Thank you.